Happy birthday, Kelly.
All right, yeah. Happy birthday, Kelly. Thanks for sending your dad in. Appreciate it. Relax this side right here a little bit. There you go, beautiful. Oh yeah, that was nice. Mm-hmm. They blurred common and normal. Those words have been made synonymous. They're not synonymous. You're right. It is common for people to not have curve in their necks. It is common for people to wear out their lower neck. It is not normal. Why am I the only one to talk like this? I don't understand why this is so complicated.
I'm in the construction
Yes.
business. She owns a cleaning business. Whenever I do anything with my right shoulder, my right arm, it for days it takes me to recover from that.
And the symptoms are up in the trap here?
Yep,
Okay.
above the shoulder blade and my traps, exactly.
What kind of imaging was taken of your spine? Any imaging?
So he took x-rays of side views, front views, back views.
No MRIs at all?
No MRIs.
No curiosity for MRI. We on the X-ray we see the bones, right? We can't really get a. We do miss a lot with X-ray. You know, I wish MRIs were more common. I've pretty much shut down all my X-ray machines because we miss the component of the disc. You know, we can see the space on the X-ray where the disc is, but the disc can be ruptured out and it be completely invisible on an X-ray, and so we're missing information. Now, when MRIs were $2,000-$3,000, you know, it made sense to do a lot of X-rays, but MRIs now are $200, and so I just go, what are we doing? Let's just get an MRI of your neck and see what's what. Very commonly, there are 7 segments in the neck, and we find predominantly the lower 3 segments have all the injury. And that has to do with the arch or the curve or lordosis, whatever you want to call it. But the curve in your neck allows the weight to be spread evenly. And when the neck goes straight, like a ladder, all the weight goes right down to the bottom. And so these non-sensitive water structures called discs get worn out. And then when you overstress a joint, like a muscle when it's overstressed will grow, the joints will grow. And that's what we call arthritis, arth meaning joint, itis, inflammation. So the joint will get larger and then it pinches the nerve. So when you lift your right arm up, lifting your right arm is the same as tilting your head to the side biomechanically. And so when you're looking at this model, I'm going to just, so you can see easily, I'm going to tilt, this is the front of us, this is the back of us. When I tilt to the right, watch the size of that hole that the nerve passes through. Right? If I tilt to the opposite side, it gets bigger. Right? So the hole changes in size based on motion. If I tilt to the right, or to the model's left, the hole on the right gets bigger. And if I tilt towards the hole gets smaller. So do you see how when you lift your right arm up, because you have what we call stenosis, this is where maybe they saw it on the X-ray, but you'd really see it, and more profoundly the involvement of the disc with that stenosis, you have pressure on the nerve. And these nerves go down your arm and strengthen and functionality of your thyroid, so the nerve bifurcates after it comes out. So one branch is going to go to your arm and the skin, and one branch is going to go to your thyroid, and the ones in the upper back go to your heart. And that's where essentially your spinal health is your health, because these wires control not only your muscles and tissue and joints, but they also control your organs. Around the age of 50, the discs start to dry out and traction becomes less, let's just say, injurious to areas. My worry is that when I traction the spine and you're just pulling, we're supposed to be curved in here, and I wonder, right, that makes sense, straight traction pulls it straight. We want to do what we call it extension traction, which is where we're arching, but straight traction, first of all, if this area is stiff up here and this area is overworked, if I just traction the spine, only the parts that are loose will move the most. Right? The parts that are stiff aren't going to move much. The parts that are loose will move most of it. And so we end up creating more imbalance between the tight and loose areas. So I caution sometimes just straight traction, because I wonder, you know, if there's disc injury, which we can't see on X-ray, but it's likely. But if we know that there's a disc injury, the discs are like fabric, right? It's like a blue paper towel. If I pull on the fabric, it's pretty strong, but if I make a tiny cut in it, right? Now if I pull on it, where's it going to tear?
Yes, right.
It's only going to tear where it's already injured.
Right.
It's not going to create a new tear, right? It's just going to rip where it's already injured. So the disc is like a piece of fabric that where we call annular fibers, so the disc is made up of 2 materials. We have a nucleus called the nucleus pulposus, and then it's wrapped in all these annular fibers. Okay, and these annular fibers are like fabric. None of this is regenerative. It's all a produced substance. When you tear an annulus or you liquefy a disc, all of that is a permanent change. And I think of it like a piece of bacon. When you cook it, there's no like reversing the bacon back to uncooked and soft. Once you've made it hard and crispy, it's a permanent change in the bacon. This model shows how the bone will grow also. And as the height of the disc decreases, that hole gets more narrow, and now we're hitting the nerve. And then you've been in construction your whole life, you lift your arms up, there's not any space in there. So it was hypermobility that made this area wear out to begin with. And so a lot of my philosophy is to create a new area of mobility. We cannot continue to ask the area that's injured to do more. It's already done everything for a long period of time. The upper two bones up here, called the atlas and axis, are the only two bones that got names, and they're designed to do about 60% of the work of your neck. Your lower neck should be shut down completely if this is working properly. And so the more mechanical participation we can get from your upper neck, the more stress will take off your lower neck. Meaning when you lift your arm up, if this part of your neck is moving properly, this doesn't move much at all. Okay. And you won't be pinching it. Ed, I can move my arm now and it doesn't hurt anymore. Because you're no longer asking the lower neck, which has been where you've been bending for most of your life. We're making the upper neck and restoring the function of your main engine. This is like, these are backup engines, main engine. So it shouldn't really be possible. And again, I use MRI to show this. How did you wear out your backup engine without first wearing out your main engine? Right? It shouldn't be possible. You should wear this out first and then this out last. But starting at a young age, when we lose the curve and our heads go forward, the wear pattern is flipped. Essentially, the lower neck becomes the initiator of motion and the upper neck is the last guy to show up. The model also shows when there's a curve in your neck, they actually lock together. The vertebrae actually interlock, making it impossible to wear out and mobilize your lower neck because they're sandwiched together. You first have to separate all the spinuses to be able to rotate them independently. Again, that's the loss of curve, that's the arch. That's why the arch is important, because it prevents further stress on the vertebrae in terms of mechanics. The discs are depressurized when there's an arch in your spine, just so you can see it easier. When there's an arch in the spine, the discs are not compressed. Right? When the spine goes straight, we call it interdiscal pressure. It's like goes up by 8-fold, sometimes especially if you're bent forward, your knees are up, a lot of pressure on the disc. And over time, the jello-like substance that the nucleus is becomes a liquid. That liquid starts to burrow through those layers of the annulus, and then we start getting these bulges. And that's what this model here starts to show, is these annular tears. You had CPR. I saw on your paper. Tell me about that. Tell me about. You said you had.
So I had a massive heart attack, and I was driving my car down the highway, and I had a friend with me, and I had the Widowmaker. They performed CPR. They couldn't figure out what was wrong for about 4 hours. My daughter's a nurse, so she showed me what they did for 4 hours, which was CPR. They paddled me. I think in the United States you're allowed to do it 3 times.
Okay.
They did a lot more. They said we can't tell you how many times we did it. So that went on for 4 hours. Then they finally found the blockage. They put a stent in, and I was in the hospital for 10 days. Mm-hmm. And once I got out of the hospital, that's when my back started to really act up.
1 second here. Yeah, your right shoulder's elevated. You're getting away from this left side, and now you're pinching this side. It's an antalgic maneuver. There's going to be a monster in there that we need to clean and address, and that's what's going to take care of your heart to begin with. And then we have the trauma of the CPR. You're really doing proper CPR. The whole rib cage is under a lot of stress. When we injure a joint or stress a part of our body expects it to happen again. So it puts up protection and walls. So 10 years ago, you go through this event where we're trying to save your life, and rightfully so, but the side effect is now your chest got injured. And then the injury of your chest then makes the areas adjacent do extra work. So we need to go through and try to restore some limberness to your chest, as difficult as that might be. And how successful will you be? I don't know. I'm going to just go in there and start running a carpet cleaner and see how much and how willing that area is to move. Cross this arm under. All right. Bend both the knees for me. Feet flat on the table. I'm going to help you do a little sit-up. A little sit-up for me. Take a deep breath in for me. And then let all the air out. Head back. Head back for me. Keep going. Exhale. I got you. Exhale. Already moving. Exhale. Good. Deep breath in. Very good. And let your head relax back. Exhale. Good. Deep breath in. You're doing great. I got you. Exhale. Relax your head. Relax your head back as best you can. I got you. Yeah, there's the one. Okay, we'll get it. We really got to focus on that upper back. Notice I just did 3 levels, kind of that I call it the lower thoracic, middle thoracic, upper thoracic. Lower thoracic gave me a couple, middle thoracic gave me 3, upper thoracic pretty much stuck his tongue at me, right? Said, I don't think so, right? So not a coincidence. The upper thoracic is where the heart, that's where all the nerves that go. Not surprising that there's the most resistance, the most restriction right adjacent to your lower neck, right? I think of Cain and Abel, right? Abel's dead, Cain's, everybody's trying to fix Abel. We gotta fix Abel, do CPR on Abel. If you do, he's just gonna get stabbed again. Yeah. You understand, you gotta fix Cain. He's the one's the problem. No, it's Abel's the problem, right? We're focusing on your injured area, but we're not seeing what's causing it is right adjacent, right next door, right next to the injured area is the one the most responsible for the injured area. You understand? As you get farther away, you get less and less responsible, right? Most responsible for why C7 is injured is T1. I ask an inverted question. I ask, why are you not injured at T2? Everybody's asking why you have all these disc injuries or bone spurs, let's say, arthritis in your lower neck. No one's asked the question, why do you not have injuries in 80% of your back? The reason why that 20% is injured is because the 80% that's not injured doesn't work. And that's your care. And I know, let's try traction to 20%. Let's try to adjust to 20%. I'm like, the 20% that's injured is injured because it works. Functionally, it's already working. What am I going to do? Beat it up and make it work more? It can't be helped by further punishment. I do a little traction like this, but I'm not trying to do this to stretch you. Whenever we hold the spine for about 20 minutes, we're changing position. I use traction to unlock. So the vertebrae, if they're smashed together, they won't rotate. I'm trying to separate them a little bit to get them to rotate, maybe like a piano. If all the piano keys are squeezed together, they won't actually go up and down. You have to open them up a little bit to get them to actually move. I got your head. You're doing great. So the upper neck here, we're just trying to loosen this upper neck a little bit. Just this top guy. Very, very gentle. I got your head. Promise. I got your head. I promise I won't drop it. You relax. I got you. Real gentle. It's okay. It's okay. There we go. Give it a second. We're going to go deeper in a second. I just wanted to get you started with that upper neck. Ed, I think if you went a little harder, you might get more bones to move. I'm not trying to move every bone in your neck. Right? If I move what's tight and I move what's loose, do you see how I haven't balanced you? There we go. I got you. I got your head. I promise. There we go. And then relax this side right here a little bit. There you go. Beautiful. Beautiful. Just giving a caution note. I want to be careful to not aggravate the lower neck. My life becomes like the movie Groundhog Day with Bill Murray. I feel like I'm living the same day over and over again, but nobody else is alongside me understanding this, right? I'm the only one that's noticing. Over and over again. Every MRI I look at, let me guess, C5, 6, and 7. There it is, C5, 6. Now there's neck surgery. I wonder which vertebrae got operated on. We never see wear and tear in 80% of the spine. We see wear and tear occurring in the same 20% of the spine, and no one's. It's like Wizard of Oz. You pull back the curtain, there's a guy standing there pulling levers, and never mind the man behind the curtain. Why is it always C5 predominantly going first? Why is it always L5, lumbar 5? You always hear about lumbar 5. That's the last guy in your lower back. 75, and this is not from chiropractors, this is from the surgeons. They tell you where they operate. 75% of lower back surgery is one vertebrae, L5. 24% is L4. 1% is L3. Above that, you're getting like 1 in a million. You get very 0.00, very, very low percent chance. Do you want to say why? It's not age then, because they're all the same age. I had a 12-year-old girl with disc herniations, 110 pounds. She's not old, and she was thin as anything. So it's not age or weight. It's alignment and mobility. Whether you have a F-350 truck or a Miata, it doesn't matter. The vehicle has to have the tires on straight.
So what is the real reason?
Alignment and mobility, right?
But
So,
I mean, what causes you to be out of alignment?
right. It starts at a young age. I'd even say it's a birth trauma. Babies are born, all 4 of my children were born, and they favored turning their head to whatever side they were in the womb. So the last 3 months of pregnancy, your baby's actually not, I know we always think the baby's in there like this, right? Maybe people think that, right? They're in a fetal position. They're actually not. They're actually rotated. They're twisted in there. And when we're born, we call it restitution. The baby spirals their way out. So the last 3 months, you're pinned. And so you come out favoring whatever side you were rotated to for 3 months. Imagine if I took you for 3 months and immobilized you,
Right.
rotated to one side,
Right.
and I had you stand up straight. Which way would you immediately go?
To the side, yeah.
To whatever side you were stuck in, right? So all my kids were born favoring turning their head. Like I have my baby on my chest at the hospital, right? The baby would just turn their head right? I gently turn their head left, right? And what does the baby do?
Back to
Like
where
that,
we were,
yeah.
yeah.
Does anybody care to evaluate this? Is that a problem? Does that matter? Does that matter that your baby, right at brand new, not in pain, doesn't have any disc injuries, doesn't have any arthritis, but they have a disposition, an inclination to favor whatever side they're rotated to? And how are you going to fix that? Well, you can't. The last 3 months of pregnancy, you're stuck in a. So you need to have somebody go in there and adjust them.
Right.
So we have trauma at birth. We have favoritisms that develop. The kid goes to sleep always turning their head to the right, and nobody checks, nobody cares. And when they're 10 years old, they have a football injury, whatever. And so it's little things. It's not a simple story. It's a summation. Not normal to have these soreness along your spinal column. You have injuries. The body goes into guard mode, so it tries to spasm and protect things. So this is why I work on you laying down. I take gravity out of the equation. I take posture out of the equation when I lay you down, right? So now anything that's still tight when he's laying down is guarding, right? He's guarding it. If I rubbed your back when you're sitting, do you understand? Part of the reason why your back is tight because your head forward, right? So how do I distinguish between muscles that are tight from bad posture or muscles that are tight from trying to protect an area that's injured, right? The answer is you can't.
Right.
So very silly, I'll watch sometimes people get massaged in an upright position. They're like, oh, you have all this tension in your back. I'm like, it's because their head's forward. Of course they have tension. Lay them down. And then you'll see some of the tension goes away, the postural tension goes away, and then you're just left with the injury tension. Your body will protectively spasm an area. And then how can I give a chemical to undo that? Here, take this muscle relaxant. The body's purposefully tasering that area. I always wondered, we should try to set that up, Carl. Give me a bunch of muscle relaxants, and then somebody takes a taser gun and shoots me with a taser gun, right? And sees if the muscle relaxants work. Think it'll work.
Just shooting you with a taser gun would be fun for you too.
We might have to try that. Right? I'll take a lot of muscle relaxants and see if it works. Right? And then shoot me with the taser gun. Oh, it's not working. My muscles aren't contracting. Pretty sure they're still going to contract. Right here. This is your heart. Right there. I gotta unlock this area.
go. There you go. I know. Gotta let that one go. I didn't know I was holding tension there. I know. Gotta let this area be. It's been guarded for a reason. There's injuries, but we have to allow entry so we can go in here and sweep up the glass, sweep up the damaged things and get them out of here. Yeah, right there. Okay, come on, let the shoulder go. I know. Whew, he's right here. You didn't protect. You notice the difference here. You weren't protecting this side.
Right.
Right here, you do not. I worked on as hard as I could on the left side. He was barely flinching, and then I found his flinch spot right here. He keeps wanting to pull his shoulder blade back to protect it. Right? It's lock it up, and I'll just go easier. But we gotta. It's got to be opened up. It's got to be cleaned out. So his right lower neck that's being pinched, and so this is all inflamed here. It's not just the muscles are tight. There's also stenosis in his lower neck, but it's ultimately the left side injury that then threw the work to his right. But that was 10 years ago. I mean, it's healed crooked kind of idea, and now we have the we call compensatory injury. This is the right side of his neck and right shoulder. This is just the compensation for the original injury on the left. X-rays, we can't see everything. 1895, it's better than nothing. Okay. MRIs are like the 70s. At least we're in the last 100 years. I think of it like Plato's allegory with the cave, right? The prisoners are in the cave and they're faced away from the opening, and the shadows of the people walking at the entrance are being cast on the back of the wall, and the shadows become their reality, right? They've been in the cave for so long that they think the shadows are people.
Right.
They're not people, they're an image of something behind you, right? That's X-rays. You're looking at a shadow of what you're looking at. You're not seeing the real thing. You're seeing you're shining a flashlight on my hand, and then you're looking at the wall, and then you're making a judgment of what this is based on what the shadow looks like. MRI is not a shadow. You're looking at the actual tissue. This is actually, it's based on water. Water has a magnetic, polarity to it. There's a positive and negative charge, and most of your body is made of water. So they put a magnet on your body, essentially, around one side of your body, and all the water molecules change, they rotate to line up with the magnet, and then the magnet moves. And all the water molecules resonate. That's what magnetic resonance, they make a resonance as they rotate. The computer is able to read that movement of the water as a signal, and that draws an image of your body. But it's not like a shadow of it. It's actually because your body's made of water, it's making an image of the water. There's no radiation. There's no ill effects. Whenever you shoot X-rays or CAT scans, you're harming the patient to a very small. It's not good for you. So it's another reason why I'm not a big fan of them. It's like, Ed, it's just a little bit of radiation. It's no big deal, Ed. Calm down. Same year chiropractic was born was the same year X-rays were born. Really? So we're like twins at birth that grew up together. And why is it, Ed? Why do chiropractors love X-rays? We're twins. Conjoined twins, that's what I was thinking. Has anybody really dug in here hard? Not too often?
Never.
No? Okay. Yeah, okay. I mean, it's standing out as the biggest problem.
Really?
Even your neck's relatively beautiful compared to this. I mean, it's a solid. He folded too much for 60 years in his lower neck, and he can't fold there anymore. It's worn out. It's lived its entire life. It's lived its 110, 20-year life. In 60 years, it needs to retire now. And we need to recruit other areas that are not injured to wake up, to serve for you, and to work for you. But the spine is a volunteer basis. They have to show up. When you're stretching, you only can stretch with the vertebrae that showed up. You don't bend where you're not moving. You have to first unlock those areas so they start to volunteer. And that's my job, is to sort of kick their butts, get them on the assembly line, get them on the football field, and now they're playing the game. And then we can maintain that through stretching. Yes, yeah.
you like the water?
I'm okay. Might be in the way of your own light.
So now that's the gua sha, correct?
Yes, ma'am. Yeah, this is the tool for just increasing circulation. Yeah, right there. That's where it's blocked. Right at T2, 3 here. Right there. The nerve adds up everything that's influencing it. If it reaches a certain value, we become aware of it. But in the process, it's like a light switch. I can put pressure on a light switch to move the switch upwards, but until it finally goes over to the other side, the light's still off. Right? But the switch is moving, but it's not reached the threshold. So nerves are weird like that. They don't give you anything until they're giving you something.
Mhm.
There's no it's not like a dimmer switch where it gives you partial, 50%, 75%, now 100%. It's 0, 100%. It makes understanding them difficult because they don't give you any information until they're already gone. Before they're already it's like a cavity in a tooth. I felt fine, I'm dying.
Right.
That's nerves. We have words medically for the principles. They call it action potentials, resting membrane potential. We have words that we use in neurology to explain this. There's summation. A nerve is irritated and it gets closer to its firing point, to its action potential. It's not like on your evening news they're going to talk about it, though. Hey, everybody, we're going to talk about action potentials today.
Yeah.
Nobody's talking about this stuff. But. And the middle back will control your lower back. So, issues in your lower back and the hips ultimately stem from the middle back. The middle back getting tight, again, because of the head. So these are dominoes. The tightness in the middle back can only be resolved by getting the ear and the head back over your shoulders. But you okay? Skin's fine. There's no
fine.
piece of my people like, you ripping the skin. It's not that much pressure. I mean, it looks maybe or sounds more, but it's not. I'm not going that hard with it. Usually it feels good. Everybody's like,
It does.
combing it's like combing your hair. You're just untangling things. The tool works like a hairbrush works better than your hands through your own hair, your fingers through your own hair. A brush is going to work way more effectively at untangling. And this tool works the muscle fibers and the connective tissue, the fascia underneath the skin in a different way than just my elbow works or my thumb. Okay. Ooh, yeah. That was nice.
Mm-hmm.
T1, T2 moved. It was probably, I don't think that's moved in a while. It was like a very subtle, it was like, hey, I'm in here. I tried getting it earlier and it didn't like me. It didn't even know who I was. There you go. Okay.
Now, by doing that, how does that just loosens everything up?
My goal is to run through the entire team, the entire factory, and see who can work.
Okay.
Right? So
part of the reason why his body goes forward, even with his head, is to avoid this. Well, Ed, my lower back's fine. I know, but you're in avoidance, which pops this up. This gets into avoidance because this is stiff.
Got it.
This being avoided makes his head go farther, which tightens this up. So they're all
Connected.
so getting a little bit more mobility restored in his SI joints takes stress off his lower back, which makes him more likely to do some of the stretching that I'm having to do. I need him upright, but your body goes forward to run away. And the things that you've been running away from, maybe you've forgotten about.
Okay.
And then when I start turning you around, you're going to start having to confront the things that you run away from, because the inflammation and tightness of our back can only be ultimately fixed by changing his posture. Massaging his back and adjusting him will give him a day, 2. And we live in a relationship where, you know, we can go to chiropractors frequently or symptoms come back, and I believe that if we can restore the posture, greatly can reduce the frequency of care in the office. That the care is to make the spine limber so that the stretching is effective, so you don't have to keep coming back in. You know, but that's the way it works, because I've given you the tools, and then I become more like an overseer or an air traffic controller. I'm making sure you're doing you're progressing on your stretches. So your effectiveness, a lot of these stretches is, to me, it's limited how effective they're actually. The neck guy, I'm going to see in a second when I work on you. I believe you should be actually working on your upper back guy. As the yellow guy goes in between your shoulder blades, maybe a month, and then the neck guy will become effective. I'm not even sure. Have you shown tools like this? Nothing like this yet?
Yeah,
We have one.
Okay.
Yes.
You have this guy?
Yes.
Okay, so this guy, I'm saying, has some benefit right now, but I'm saying I think that you should be working on the upper back. Do you understand? This guy goes up here because we got to get the chest in. So
Right.
you see if the head's forward, how much pressure this is on is limited until this comes back. Now
Yeah.
you're actually putting pressure on this
Okay.
because the chest is in. Deep breath in for me. Easy. Exhale. Exhale. I got you. Uh-huh. Uh-huh. Good. Very good, huh? Outside. Does he do something similar to this? No?
Sometimes.
Sometimes? Okay. The goal, I'm just going to so remember how all surgery happens here? Just notice my hand is not on his lower back, right? What am I? I'm contacting above, right? And below, right? We leave the lower back alone. So I'm just saying one day, if somebody goes in here and starts pushing right on L5, I would caution that. I go, why are we doing that? We want to work on the areas around. So I'm down, why are you grabbing his butt? I'm trying to loosen this joint called the sacroiliac joint. Good, it's okay. This is just help to drain lines that drain the face. I find that, sinus congestion, ear congestion improves mainly by getting the head, neck healthy, but also you can also work on the ear and the channels around the ear, and it's also something fun to do. And we can just loosen this up. All right, go ahead and tilt your head to the right for me. So you bring your head to the right, tilt. Oh, good, it's okay. Go ahead and tilt your head to the right, tilt right. Oh, good. All right, go ahead and tilt your head to the left. Oh, it's okay. And go ahead and tilt left. Okay, it's okay. Move it in here. There we go. Ooh. There you go.
Wow.
Ooh, 5 for 5.
Wow.
Good. I have 10 for 10. Oh my gosh.
It's a good day.
A perfect score. Good. All right. All right, we're gonna you're gonna do a little slide. So while you stay up, very good. Get the idea? There's a tissue pull. So watch me for a second. See how the tissue moves around?
Mm-hmm.
I want a downward feeling. So to accomplish that, you're gonna the device is gonna put pressure on your back, and you're gonna slide so the device feels like it's got not just pressure inwards, but pressure downwards at the same time. Can you envision that?
Yep.
So to accomplish that, you kind of just, as long as I think you got it. But get the idea? Remember?
I do. I felt that
You slid a little bit on
Yeah.
it, and so it feels like it's giving
more of a.
inward and downward pressure. I don't want inward and upward pressure. I want it doing this. Do you understand? Not this. I don't want it lifting. They made a device that emulates my thumb or elbow that you can use stick it in here, and it's not as good, of course. You know, but the point is, it's as close as we can get.
Right.
I don't have a bottle of Dr. Ed to give you,
Yeah.
but I can give you a.
darn.
I was just gonna say that.
Sorry.
Can you get
Well,
working on that?
Ice the lower neck. If you want to do anything symptomatically, it would be ice or salt. So on your right lower neck, right in that valley, in that crease, you take an ice cube. Numb it down for 10 minutes.
Oh,
All right, see how that feels. Let me see your
Yeah,
posture a
feels
little bit.
good.
Yeah. Yeah, looks good. Looks good, my friend.
Thank you.
Pleasure. Yes, sir. Thank you. All right. Take it.
Can you get a picture?
Oh, yeah.